Well, the Scottish approach to integrated care has a number of lessons for our members and for an international audience. And I think one of the things that comes through very clearly is that they've had national leadership around integrated care for well over a decade. And this degree of political leadership, this degree of political consensus over the need for integrated care, particularly for older age adults, has been a policy direction for a number of years. And that's manifest in things like Health Improvement Scotland, in the Joint Improvement Team, in the development of a whole range of institutions that are seeking to proactively go out into communities to be able to support them to develop new approaches to integrated care, to bring health and social care together. And as a part of that journey, of course, you now see the structural, for the formal integration of health and social care for older adults coming into play just this year. So that journey is really very important, because without that political momentum from the top, it's very difficult for integrated care to grow from the bottom up. As in any country within the world, integrated care is more easily said than done. So what I would say to Scottish delegates at this conference and in taking integrated care forward is really to focus on really quite small scale changes, things that you're able to manage within 3 months and 6 months and 9 months. So think big, but start slowly. Bring together all of the different partners in care locally, which includes the local community and people, as well as different organizations, to really begin to think differently about what integrated care means to you and in your context. And I think it's true in Scotland, it's true in the rest of Europe. I don't think enough is yet done to really engage the hearts and minds of local professionals and local people on what integrated care means to them. So rather than imposing integrated care as a solution on people, it's got to be drawn from the people themselves. So that's the next step. We've got all of the policies are in place, all of the different support mechanisms, all of the different knowledge is there. The issue is, how do we turn that into action? It only can be driven from the bottom up.
It's been absolutely fantastic opportunity. We've come from Ireland, from the HSE, and we came to make connections and to network with people. So that has been absolutely amazing. The people I've met that I would have networked with on Twitter, who I now know face to face, so that's really good for me. I can go back with connections that are much more tangible, and in that have further communication with them that's real. The other thing for me was in relationship to the identifying frailty. And so that's one of the big issues we have at home in Ireland, is about the identification of that frail older adult prior to coming into the acute hospital or at the front door, and hearing what people have done in Scotland in relationship to that. And we spoke to Karen and Joy, and they shared about their experience, what they do in relationship to the huddle. And so we can take that information back. But more than that, we have the connection that we can actually come back to people that we now know, and we can ask them to go through it again with us, or to give us more information around the questions that we'll have when we've reflected and gone back to our own environment. So they're the real main things I've got from today so far.
I think first of all, I think there's lots that we can learn from each other, because I think the similarities are much greater than the differences. So what our patients, our service users, our carers, our taxpayers want is largely the same thing, which is independence and well-being. So I think what we can learn from Scotland, I think in a lot of respects you're ahead of where we are in England, and I think we can learn from that work and use it, although it's a different context, but I think it will translate across. And secondly, I think there's other areas where in England we're perhaps a little bit further ahead, or we tried different things, and again I think we can share those learning. For me, I think that what works is generally dependent on what's available locally. So for example, it might be that Edinburgh and York are closer together than say York and Birmingham. So I think actually learning from those localities is really important.
Well, I think we're dealing with a really complex problem, and it needs a complex solution. Our progress, I think, in both countries is inevitably going to be uneven. So it's great if we can take some of the things that are working well for you, which means that we don't have to experiment with them in England, and vice versa. So I think essentially it's about sharing our work and our progress.
I think that Catalonia and Scotland share a lot on different plans. On the healthcare perspective, the models are quite similar. There is a main difference that probably Scotland has a more top-down approach to foster care integration, which is the way to go in this moment. And Catalonia probably has a bottom-up strategy with many experiences coming from professionals and providers, and sometimes with the difficulty of putting this into a frame, legal frame or budget and reimbursement frame. So probably we can learn from each other because we have the different approaches, and we should complement one each other. I think from the conference it's clear that the way to go is to put the attention on older adults with frailty in this moment, trying to do an integrated care approach, healthcare and social care, to be proactive. And I think we have a great expertise of professionals in both countries. And probably we also have the resources. We have to reshape the system, and also we have to change a little bit our way of taking care of these people, going towards a more person-centered care, in the sense of getting more the people involved in care, sharing decision with them, and potentiating the advanced care planning. So I think all these elements, we have a lot of these elements are clear to many of us. The point is to see how we contextualize them, and in this sense we can share what we do. As the last aspect, the intermediate care sector is very strong in the two countries, so probably this could be an added value for this care integration for the benefit of older adults with frailty.